Hi, my name is Vicki Blevins. I'm Executive Director of the Kentucky Pink Connection. Kentucky Pink Connection was founded in 2008, and basically the concept came from my years as a retail store with mastectomy products, a boutique for women who were facing diagnosis of breast cancer in need of a wig or prosthetics. And for 8 years I had that business, and through that journey I knew there was a critical need for women who were uninsured and women who did not have the resources to buy the products that were needed. And in the fitting room I often heard the stories of many women and their barriers that they faced after a diagnosis with breast cancer, which prompted me and a few others to form the Kentucky Pink Connection, which is a patient navigating service for women to relieve some of the barriers that I knew they were facing. And so in 2008 we started Kentucky Pink Connection with a grant from Susan G. Komen Lexington affiliate. And over the past 5 years we've been able to serve approximately 3,000 women in the state of Kentucky who are facing barriers such as gas cards and needing a screening, and also possibly lymphedema garments. They are a side effect of breast cancer which causes lymphedema in many patients, and they're in need of a compression garment and they're not covered by insurance, so that's a big need. But the many barriers that women face was the mission of Pink Connection, and we've been able to accomplish a lot of our goals over the past 5 years, and we continue to serve the women of Kentucky as we reach out to the communities across the state and let them know about our services.
My name is Toni Davis. I'm a patient navigator at Kentucky Pink Connection. We work with men and women throughout the state that have been diagnosed with breast cancer, and these are some of the bravest people I've ever talked to and met. We also work with women who need their mammograms and do not have health insurance or have very poor health insurance. It's a privilege to work with these people and to help them and relieve them of some of the burdens that they face in dealing with breast cancer throughout the state.
It just really means a lot to me knowing that Vicki and her staff are only a phone call away if I need to refer somebody or have a question myself. In the beginning, it was pretty daunting to find out that my medication would be almost $500 a month, and I just must have given the pharmacist a funny look, because she gave me a funny look back, and she's like, well, what do you mean? I said, well, that's another full-time job to pay for medication.
My name is Sharon Gibbons. I was diagnosed with breast cancer in May of this year. I am so grateful to the Pink Connection and everything that they have done for me. From the first day that I made contact with them, it's been like I've been their only client. The way they relate to you, it's as if you're the only one they're working with, even though I know that they have gobs and gobs and gobs of patients. But for me, it just feels like, you know, each time I talk with them, it's like one-on-one and I'm the only person. And that's been so helpful in me getting through this process, this journey. I can't thank them enough.
My name is Brenda Dunaway. I'm a cancer survivor for 3.5 years. And in 2009, I was diagnosed with breast cancer. And it was devastating. In August, I went in hospital, had a mastectomy, and they said they got rid of all the cancer. I was stage 3. And so went home and stayed in connection with Vicki and Pink Connection, where they were helping me. I went through reconstruction. Vicki helped me at Pink Connection. And then I'm 3.5 years out of cancer, and I give thanks to God first, and I give thanks that God had sent me Vicki and Kim at Pink Connection. I appreciate them.
I'm Virginia McKinney from Cynthiana, and I have had lymphedema in my arms for 13 years. I had breast surgery 14 years ago, and they have been great to work with, and I would recommend anybody trying to get in touch with them and to do what they tell you to do.
I've been at UK Markey Cancer Center for 2 years now, working as a social worker, primarily working with breast cancer patients. Seeing the struggle that they go through on a daily basis, and I can't say enough about the working relationship that I've established with Kentucky Pink Connection. Vicki and the ladies are just wonderful in the services that they provide. We couldn't do it without them. Between assistance with mastectomy supplies or wigs, head coverings, transportation assistance, the list goes on and on, that they will, any need that there is, they will find a way to provide for that person. And it's just very valuable, and the compassion that these ladies show for the breast cancer patients is just tremendous. They have a huge commitment to these women. The population that we serve at Markey is a little different in that there's a lot of financial disparity, and they sometimes just need the basic needs and necessities, and so their needs are, quite more prevalent than, maybe some other institutions. So we have to work very hard with this group to make sure that we can help them and overcome the daily stresses that are involved in the cancer diagnosis, and try to help them overcome those. It's a teamwork. It's definitely a team approach. We make referrals to Kentucky Pink Connection by filling out a referral form. It's a very simple one-page application, and we fax it over, and we have a mutual HIPAA policy between the two institutions, so all information is kept private and confidential. It's just a very easy system, and a very, very good working situation between the two institutions. Kentucky Pink Connection has been very helpful in helping me understand the needs of these breast cancer patients, and it makes me just feel very committed to helping better their lives every day.
So my name is Melanie Wilson. I work as a patient navigator for the American Cancer Society at the University of Markey Cancer Center. I became affiliated initially with the Kentucky Pink Connection as a past board member, and I refer folks a lot to the Kentucky Pink Connection for services such as wigs, head coverings, prosthetics, lymphedema sleeves. One story in particular, I can remember assisting a patient, a cancer patient, breast cancer of course, and she was asked to participate in a fashion show that the Pink Connection was hosting, and that meant so much to her. It just really, it really gave her a sense of hope and dignity, really restored that dignity and self-esteem in her, and that's really what it's all about. It's about giving patients hope, and of course restoring their dignity. I can remember initially, whenever I became a board member, seeing a sign on the wall at the Pink Connection, and it was a quote from Irma Bombeck, and it said, "When I stand before God at the end of my life, I would hope that I would have not a single bit of talent left and could say, I used everything you gave me." And that's kind of what I envision and think about when I think about the folks here at the Kentucky Pink Connection. They certainly do make a difference, and whenever folks do receive a wig or something of that nature, it's oftentimes, I think, the little things in life that really mean the most, that really add up to big things. And so I'm grateful for them and for their services for the patients.